Welcome back. We are done with the theory now, so we can hopefully apply it and talk about some interesting issues that emerge around us in the world, starting with healthcare. So today we will talk about healthcare ethics, which is chapter 10, and then we will talk about social justice and economic justice and related issues. So healthcare ethics. First of all, what is healthcare ethics? Thinking about ethical issues in relation to human health, obviously. And it is in turn part of bioethics, which is kind of broader one. It's the application of ethical judgment to topics involving life and living things. We're not going to go into all the details, especially since most of you guys are probably not in healthcare and it's of less interest to you. But there are some interesting things which you may want to read in chapter 11 and 12 if you want on your own. And you can also apply it to your papers if you want, especially if you have interest in this field. So bioethics in general also includes technology to fix, engineer, and enhance living things, which is obviously a big topic now since it's becoming available to society in general, and we are wondering, is it ethical? Is it moral? Should we do these things? Should we indeed modify human beings, and so on? Care in general is obviously central idea of health care. Now, what are the issues we may see here? Healthcare and medicine. Issues arising in thinking about birthing and dying, abortion, euthanasia, and so on, which is again discussed in more details in the chapters 11 and 12. Use of technology to tinker with, fix, enhance, and engineer living things. We're not going to go into that, but this is more of a bioethic issue. Non-human animals, there is a chapter at the end of the book talking about that too. And environmental ethics, again, there is a chapter at the end of the book which we're not going to go into. Now, one term we need to mention at the beginning, casuistry. What exactly is casuistry? Practice of focusing on the details of particular ethical cases. So basically you take a case and you break it down. You look at it from different points of view. You apply different theory, study in relation to similar cases, use analogies, principles may be applied, conclusions are drawn. Technically, that's a good approach for all the case studies which we had on, you can find them on Canvas, related to engineering issues and so on. So it's good to learn, discuss, and consider. Potential problem there that we may kind of lose the forest behind the trees. We may get stuck in the details of the case without any way of sorting it out. So for our purposes, applying the theory, which we have discussed in the first half of the class, is more interesting and important. We can also apply the theory in a similar way, for example, consequentialism. Remember, consequentialism looks at the consequences of your ethical decisions. So utilitarianism is a good example. In utilitarianism, remember, Mill was trying to figure out how to maximize happiness of people. And if we make a certain decision, we can look at the possible consequences and ask ourselves, does it maximize overall happiness? As we will see, that's not as easy, and many of the issues we'll discuss today will be good illustration of how there are different problems which arise when you start to figure out how to maximize happiness, and at the same time take into account non-consequentialist theories such as for example, Kant's theory, deontological ethics, which emphasizes human autonomy, our ability to make decisions for ourselves. Non-consequentialist theories focus attention on questions about autonomy, rights, consent, so in particular patient agreement to the treatment. Do we need to get patient's agreement to a particular treatment? And how can we obtain it? Virtue ethics, on the other hand, would be looking more at the character. Remember, that's what Aristotle in particular advertised, you may say. It points us to what kinds of healthcare professionals we should be, rather than outcomes or autonomy and issues like that. Now, first of all, since it's healthcare, what exactly is health? Let's look at the definition provided by the World Health Organization. It defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So, complete state, that includes not just the fact that you don't have any deadly disease, but how do you feel overall? Are you in good physical shape? And that, of course, is rather broad, because when you want to be more specific, if you ask about specific people, are they healthy or not, you want to have a better criteria. Just having a criteria that, well, complete state is complete state, that's not good enough. However, once you start going into these details, you may tap into ideological issues. What exactly is it? Well, there's a reading there by Jonathan Mertz, who argues that health is a term replete with value judgments. Remember value judgment? What is a value judgment? Exactly. So you immediately tap into this. What is a good health? What is a bad health? What is a good weight in particular? What is a bad one? And that also brings up here is blind assumptions that speak as much about power and privilege as they do about well-being. And according to him, health is ideological position. Of course, health is difficult to define, so that inevitably brings up values and value judgments. Now, let's think about it. So what exactly is ideological position? Ideological position is holding a fixed set of ideas regardless whether they prove to be right or wrong. Right? So that's a danger. Why is it a danger? Well, if somebody doesn't care whether something is right or wrong, but they hold it for purely ideological reasons, then the outcomes may not be very good. Right? We do want to make sure that the position we hold actually does have connection with reality and not just with us wishing it to be so. We'll talk more about ideology, by the way, when we talk next week about Marx, because Marx had very good work on it. He probably is among the first who actually looked at how ideologies work and so on. But in relation to health, so definition of health is difficult to come up with because it's difficult to define illness and disease. For example, a color blindness. Is it a disease? Myopia. Remember I told you that after 45 you start having trouble seeing things up close, reading a book without glasses. I discovered it myself and was a little disturbed by this, especially for someone who, for the first half of my life, had practically perfect vision, and then suddenly, it's not a disease, but is it a disease? It's just something which happens with age, and I find out, I didn't even know. Nobody told me, but then when I started reading about it, it turned out that almost everybody has it, and it gets worse. And you can actually have an operation to correct it. But the problem is it immediately starts getting back worse, so you just reset it by a couple of years. And you have to pay for it, obviously, and you have to go through the trouble. And it's like, well, what's the point, right? I may as well just wear glasses. And then it gets to a certain point when it doesn't get any worse, but by then it's pretty bad. So is it a disease? Are you healthy? Am I healthy? with this? That's the question, right? So let's talk in particular about lower weight. Now, is this healthy to have a lower weight? Or to what extent, though? Right? We could all agree that obesity is a problem. But what is healthy weight? Right, but for policy, we do need some sort of criteria. Like, you can't have a policy and say, well, whatever is good for individuals. If you want a policy, for example, like, do we have an obesity problem right now in this country? It seems like we do, but how do you define it? Where does the problem begin? At what specific, what do they call it, body weight index, right? There's also a question, is it muscle or is it fat, right? Because if it's a lot of muscle, it's not nearly as problematic. But if it's fat, then obviously there are cholesterol issues and so on, which goes with that. And yeah, you're right. And it's difficult to say. And look at the opposite scale. Have you heard about some professional models who are bulimic and so on, who are afraid of eating literally anything? And it's not just that, well, it's becoming unhealthy in itself, and there is a pressure on them, right? Some of them wouldn't even mind to go a little bit easier, but they're constantly shamed and basically excluded by the industry if they are not super thin. Like, I heard some stories, if somebody has certain size of the dress, and when they get into the audition or whatever, this size is required, somebody may make a comment like, oh, we have a fat girl here. We have a fat girl. And of course, they are not fat, right? Because it's all super thin. It's just that some of them may not be as super thin. And so immediately this is the reaction. Of course, if that is the reaction, then you may indeed feel like you have to eat almost nothing so that you would maintain this insanely low weight. But then that also is problematic, right? So that's an example, right? We can think about many other examples where defining health is a little bit difficult. We can see that you can go into either extreme, like obviously way too much weight is not good, way too little weight is also unhealthy, but where do you find that specific criteria? What exactly is an ideal weight for a human being? It's a little hard to say. And additionally to that, some people have genetic predisposition, right? And then what do you do with that? Is this then a disability of some sort? Or is this normal? It's a big question because for policy purposes, that is important, but at the same time it's hard to define. Okay, so some examples. Measurement can be subject to interpretation, just like you said. Is 200 pounds a lot, a little, healthy, unhealthy? Even for particular height, if you know the height of the person, it's hard to say. If it is a professional football player and it's all muscle indeed, that may actually be not bad at all. But at the same time, if it's some sort of a small person who doesn't do any sports at all, and it's mainly fat, that doesn't sound very healthy. Health cannot be reduced to a simple set of objective measurements. That's pretty much the point, right? You cannot just say it has to be this many pounds. And there's also some cultural issues, such as cultural competence. There may be other ways of thinking what health is. Just as an example, Hmong culture understands epilepsy as a matter of spiritual health. In fact, majority of those psychological disorders, they are hard to define, and it is also bordering on ideology. A great example is homosexuality. It actually was officially considered a disease for extremely long time. It was in DSM, this manual they have of mental disorders, right? Then finally realized that this is not a disorder. It should not be treated. But what about the other ones? There are many of these mental disorders there which, again, seem to be kind of rather subjective in a sense. And even though professionals may all agree at the point that it is indeed a disorder, but once 100 or a couple of 100 years pass, who knows, they may decide it's not. Foucault actually argued that almost all of this mental and related treatment is ideological in essence, that society does it for purely ideological reasons. Now, health optimization. What is more important when we try to make people healthy, try to set up the policy to prevent death or to limit the other damage to the society? We'll talk quite a bit today about the COVID-19, because that is a great example we had when all those issues suddenly came up. They were not as important prior to that, but suddenly with COVID-19 we had to face them all over the world. Different countries had slightly different approach. There are many similarities, but this is an example from what people are facing. Prevent deaths, right? On one hand, obviously you want to prevent deaths. You don't want people to die. On the other hand, how far do you want to go to prevent deaths? Many people were arguing that, well, okay, a lot of people who are dying right now are like 90 years old. Do we really want to shut down the entire society and prevent young people from going to school and going to college and socializing and inflict mental damage on them just so that we could prevent the death of a person who would die anyway within a couple of years? That was a real issue. So how you resolve it is hard to say, especially since, again, what do you rely on? You rely on science, but science, especially at an early stage, was unable to give you good answers about how really dangerous it is, how likely are people to die. They started getting some statistics, but at first it was not very reliable. It was hard to say. There's a person died who was like 30 years old, but then again they had some other deadly disease they already had. So when it becomes large numbers, it is at first hard to say. You really have to look deeper into it to figure out how dangerous really is it. And at first there were conflicting reports. Some scientists were saying it's extremely dangerous. We should definitely not get this disease at all, because not only can it kill you now, it can do some damage to your neurological system and so on. Other scientists took an opposite position and were saying, oh no, it's basically like flu, just a little bit worse than a flu. We shouldn't worry that much. And so these issues came up and we had to deal with them because, again, remember, that was not a hypothetical question. The government had to come up with the policy. And they did, because very quickly they were forced to. One of the issues we had during the pandemic overwhelmed hospitals. There were no room for sick people to put in a hospital, so clearly something had to be done. Even the governments, like in Britain, the government there at first took this kind of more of a, I would say, libertarian approach and said, yeah, that's fine, let's just let it pass. But as soon as hospitals were full, they had to do something too, because that became a huge strain on the system. And then think about it, it's not just people who have COVID, people who have heart attacks, people who have other issues. There's no room. Every single nurse is busy, every single doctor is already taken. So what do you do then? Just let them die on the street? That's a huge problem. So, of course, we need to come up with, and there are certain codes and principles which are supposed to guide medical professionals. One of the oldest ones we have is so-called Hippocratic Oath. Hippocrates was, of course, ancient Greek. He was ancient Greek doctor and a philosopher. Ancient doctors swore this oath, promising to practice medicine ethically. They promised not to cause abortion, euthanasia, to keep confidence, So the Latin phrase, which doctors still use today, primum non nocere, first do no harm. The first thing the doctor should think about, do no harm to the patient. And that is an oath the medical professionals still take, the Hippocratic Oath. Why? Well, at least in terms of psychological effect, when you are entering the profession, it is important to indeed publicly declare that you will abide by these principles. The oath reminds us that medical knowledge can be dangerous, and you have to be mindful. Indeed, the medical professionals do have a lot of power, right? If a medical professional tells something to a patient, more often than not, patient will do what patient is told. But is it really for the benefit of the patient? So there is a lot of issues which can come up here. There has always been a connection with philosophy. Obviously, like I said, the first philosophers were also scientists. Well, they were also sometimes medical doctors. Even Socrates, remember Socrates? For one thing, he was saying that philosopher is a physician of the soul, so basically doctor of the soul. And he called himself a midwife. Midwife is a medical profession, right? So that definitely already back then was a case. Now, one of the codes we have now stems from the so-called Belmont Report. Belmont Report was produced in the United States in the 1970s by the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. Even back then it was already an issue, and one of the issues was related actually to Tuskegee experiment, which we'll talk about in a moment, because that created a lot of controversy. They issued this report, and it highlighted 3 values which medical professionals and other researchers should obey by. Respect for persons, autonomy and consent. We have to always remember that each person is an individual, just like Kant emphasized. Do not treat them as means only, as means to a research or anything else. It's a self-governing body which should be given a choice, given a possibility to decide whether or not they will agree to a particular treatment or experiment or observation or anything that is. Beneficence, we'll talk about it more today. So working for the well-being and avoiding harm. Whatever is done should be done for the benefit of the person. And justice, fair distribution of harms and benefits. That immediately comes up with healthcare, especially in this country. So the Tuskegee experiment was the following. They actually conducted research. U.S. Public Health Service conducted experiments between 1932 and 1972 for 40 years on 400 black men in Tuskegee, Alabama. Men had syphilis, and they were observing them. But they were not just observing them. They actually prohibited them from joining the military, and they were not treating them because they wanted to see exactly what are the effects of the syphilis on a person who was not treated. So even though in the 30s there was no cure for that, but in the 40s we already had penicillin, and penicillin is actually used to treat syphilis, and yet they were not given treatment. Why? They wanted to observe. So that clearly seems unethical from the modern day standard, and it obviously is, but back then they didn't see any problem. And then finally in 1972 a reporter broke this story, and by then it was already, of course, obvious that this type of treatment is unethical, so that's when they came up with this Belmont report to try to address this type of issues. So back to the basic principles. Helsinki Declaration, adopted by the World Medical Association in the 1960s, and it was updated more recently in 2013. Now that, in turn, is closely related to the Nuremberg Code, named so after the Nuremberg trials of the Nazis. And Nazis are notorious for being violators of any possible ethical principle there is. So the consent, which in each case should be given, must be voluntary, uncoerced, and informed. Because persons, again, are autonomous. They have to be given the choice, they have to be explained their options, they have to be explained consequences before they are subjected to any treatment, observation, or whatever else. Nazis in particular, of course, decided that that is not necessary to the most extreme degree. For one thing, they thought that certain nationalities, such as Jewish people, are unnecessary and should be eliminated, and they literally eliminated 6 million Jewish people. That is as atrocious as it can possibly be. In addition, like famous Dr. Mengele was conducting experiments on people. They were infecting people with diseases. They were doing all sorts of other experiments on them, obviously without any consent. Those were the people who they just considered lower races or whatever, and they thought that they can do whatever they want with them without any consent whatsoever. So that was, of course, a big lesson to the entire humanity that people are capable of this. This was not just a few crazy individuals. This was an entire country. They had laws which mandated this sort of atrocity. And there were millions of people, or at least hundreds of thousands of people, who willingly supported this entire thing. Majority of Germans obviously didn't participate in this. Some of them probably were against it, but that still was not enough. The entire country was doing this for years until they were forced to stop by the results of the war. Right? It's not like they suddenly woke up and decided that what we are doing is insane. No, they were forced to stop. So that is later on led to Helsinki Declaration and so on. So let's take a look. There's a nice table from the book with all those principles, and we will go more into them, but this is just a nice overall outlook. So the first principle is, like I said, autonomy. Autonomy, remember, that is what Kant was saying. So in other words, we are self-governing individuals. Obviously, that presumes that we do have a choice and should have a choice. Now, if you go with hard determinism, the danger here is to say that people really don't have a choice to begin with, so it doesn't matter then. But we can't operate like that. We have to presume for ethical purposes that we do have a choice and other people have a choice too. So protect people's right to choose and freedom from coercion. Then beneficence. Provide beneficial care to individuals that is in the best interest of the person cared for. Obviously, it's different from autonomy. In this case, we are talking about actually benefiting the person. Can it sometimes conflict? Yeah, obviously. We will talk about it more today. Sometimes autonomous person may be deciding to do something which is not in their best interest. Beneficence, on the other hand, tells us that the doctors and medical professionals should do whatever they can in the patient's interest, and that can contradict each other. Non-maleficence. Well, in this case, avoiding harm. So the emphasis here is not so much on doing benefit as avoiding harm to the person. Several other issues which we will also see in terms of social justice. Distributive justice. Distribute the benefit of healthcare across populations. May include addressing inequalities in health and access to healthcare. Big issue in this country, huge issue. Human rights. Respect and support human rights in healthcare associated with the claim that people have a right to healthcare. Do people have a right to healthcare or not? We'll discuss it in a few minutes. Health maximization. utilitarian principle, right? You want to maximize the health of the people in the society. It's similar to achieving biggest happiness. In this case, you are trying to achieve the biggest health. And then carefully vulnerable, as some scholars argue, health maximization may have a conflict with the carefully vulnerable, focusing on special needs of those who are most vulnerable, dependent, disabled, or lacking in autonomy. For example, very old people and some people with mental problems. So back to COVID-19. Vaccinations and masks. Those are two specific issues which came up during this period, and we all know that people drastically disagreed on both of them. First of all, autonomy. Should we respect their choice? Remember, they wanted everybody to wear a mask. It was mandated. Some people said, I don't want to wear a mask. Well, they are autonomous people. Can we force them? Should we force them? Vaccinations, an even bigger problem. Should the government mandate vaccination? Remember, they did mandate it. In fact, some people were literally cursed to be vaccinated. Not everybody, but if you are in the health sector, they were firing people. In police force, I believe they were firing people who did not vaccinate. That is coercion. They are autonomous people. But there is health maximization and beneficence. So if you know that the person will benefit from the vaccination, do you as a medical professional have a right to force them to be vaccinated? Or autonomy should prevent you from this? Health maximization. Well, this is another huge issue here, because note that the problem there wasn't just the health of the person, him or herself. Now, if somebody refuses to be vaccinated, they can, of course, tell you, I just don't care. If I get sick, I get sick. If I die, I die. And that may be fair enough, but it's a communicable disease. If you get sick, you can give it to me, and I don't want to get sick, and I don't want to die. Right? So in that sense, what is the benefit? What has more benefit for society? To preserve the autonomy of people and let them do whatever they want, give them a choice. You want to vaccinate, fine. You don't want to vaccinate, fine. Or if you know for a fact from statistics, from the science, that if everybody is vaccinating, we can save lives. And if only some people are vaccinated, then inevitably some people will die. Additional problem there was obviously it's not so straightforward that you vaccinated, therefore you will never die or never get sick. If it was that way, of course, it would be easier. But many people were just suspicious of the whole thing and were saying, well, look, this person vaccinated still got sick and died. So it obviously is not 100%. And some people don't even understand statistics. They don't understand that it may not be 100%, but you still may have better chances, right? They say, oh, since it's not 100%, then it's junk. I don't want it. That was a huge issue. And the government had to balance. So some countries obviously took more drastic approaches. Some countries forced everybody to vaccinate and forced everybody to wear the masks. Other countries went the other way. In this country, we had different states. So actually, the states took different approach. I heard in Florida it was freedom. They all enjoyed themselves in the sun without the masks. In the same time, I think Nevada was on the other scale. We had it pretty tough over here. You were not supposed to go anywhere. Like, for example, with us, some of it seemed a little strange. Like they prohibited us from entering UNLV or CSN without specific authorization. So we couldn't go to the office. If you had something left off in the office, you had to apply for authorization to come and get it. And I always felt like, well, that's a little extreme, isn't it? I mean, it's not like there are crowds of people here. It was empty buildings. I don't know why did they, well, That's just how bureaucracy works, right? If it's like all the way down. And that is what some people also don't like, because sometimes indeed you have to be a little more flexible, but bureaucracy is not flexible. If they have certain regulation, they will hammer this regulation for everybody. And that creates problems on its own, because sometimes it's just not very smart. But yeah, so that is a good example. Now, a couple more terms which the chapter discussed: dilemma versus temptation, right? Dilemma is what you may think is right versus right. You just have two good things, but you're choosing between which one. For example, doctor withholds information for the sake of patient's anxiety. So, on one hand, the doctor is trying to prevent patient from being unnecessarily anxious. On the other hand, he really should provide all the information. So that's a dilemma. Temptation, on the other hand, is when medical professionals are tempted to do something which is clearly not in the patient's benefit for other reasons. What could be the reasons? Well, there are some good examples there too, as we will see. So back to autonomy. Remember, Kant emphasized autonomy, the ontological approach. Rational autonomy is the source of human dignity and worth. Human beings are ends in themselves. And Mill also mentioned it, not so much in utilitarianism, but his utilitarianism was different from Bentham's, remember? And he wrote another work on liberty. And on liberty, he really emphasized that point, that we should have freedom of speech and freedom of decision, that we are autonomous beings. So even utilitarianists, at least some of them, recognize autonomy. Autonomy does require informed consent. But here are the problems which can come up. How do you give the informed consent in medical setting? How informed can you be? Where do you get your information as a patient? The doctor is one source, obviously, whatever doctor tells you. Can you get some other information? What if you're not sure about what doctor tells you?
The internet?
Well, the internet, yeah, that's now another possibility. The doctor internet can tell us something. And the better option actually is to go to another doctor, right? Second opinion. The problem in this country is that's costly. So even the first doctor is costly, second doctor is even more costly. And what if they contradict each other? Then what do you do? Just flip a coin? That seems like a tough dilemma, right? And informed consent, to be informed, you need to be a doctor yourself. Otherwise, how do you know? There's so many examples. When you go to a doctor, they just look at some X-ray or something and they tell, yeah, over here it's nubellus copatonus and it needs to be something. And you're like, I don't know what it means, but it doesn't sound good. But, you trust them. You have to trust them. What else do you do? But then do you really have informed consent? In this case, it does become a little bit tricky to say how informed is your consent. The example with the dentist visits, right? A dentist recommends you something. It's a better example than a doctor, because dentists, they really have less, I would say, responsibility, because teeth is teeth. It's not like you're going to die. So they recommend you something. Do they really recommend it because you need it, or do they recommend it because it's a costly procedure and they can charge you for it? Frequently people wonder about that, and some doctors, again, recommend different things from other doctors. Don't know about you guys. I can give you an example. I was recommended to remove all my wisdom teeth for years. And then another doctor told me, I don't think you even need to do that. So, do I need to do it or not? It's a costly procedure. It costs actually a lot of money. And also, if it's not done when you're young, it's not dangerous, but certainly not fun, because yeah, like it can have complications, and they tell you. And that's another thing, right? I'm sure you went to the dentist and they give you like, sign this form, which basically says if something go wrong, I can sue them, and they not respond. And they're always like, wait a minute, I signed this, you can just do something wrong and then I can't do anything about it? That's not nice. But then again, they're like, well, if you don't sign it, we're not going to do anything, so it's up to you. But yeah, so is it really informed consent? I mean, they tell you things can go wrong. And I understand that they don't control everything. There could be like nerve damage and so on. But at the same time, when you sign it, you kind of give up all your rights in that sense. So then, yeah. And whatever they recommend you, it's hard to evaluate it rationally. You go by what they tell you. If they're confident enough, if they sound confident enough, and if it's not a huge deal, you wouldn't even seek a second opinion because it's expensive. Again, like, it's a big deal to seek another doctor, pay him for all this stuff. Now, another possible problems here is paternalism. Paternalism, that comes from the Latin word pater, which means father. So it implies something like father knows best, right? In healthcare, it means that those with relevant knowledge and expertise are better positioned to make decisions, which is true. They are in better position. But to what degree should they be then deciding things? It can be controversial because it does impinge on autonomy. If medical professionals decide that people should do something and then tell politicians about it, and politicians again issue a law or ordinance requiring everybody to do something, now what about autonomy? It could seriously squash your autonomy. And then in some cases it may turn out that they were wrong in the first place, and that certainly would be very bad. And even if they are right, there could be a question. If the government is right about enforcing certain standard, is it to our benefit to still be able to disagree and not do it? Well, Plato actually thought that he didn't believe in autonomy much. Remember the Plato's Republic? So in the Republic, in a part which we didn't read, he actually discusses the fact that the rulers should manipulate everybody. And he's very, very straightforward about that. They said they should lie. Like one of the things he was suggesting there is how to arrange marriages between, well, not married, they were not marrying, but the guardians were partnering to have children, right? So Plato literally says that they should pretend that it's done by the random draw, but they should fix it and make sure that the right partners are together. So Plato saw no problem with it. In fact, Plato was, in that case, really authoritarian. He thought that the rulers, remember, the philosophers, they know best, and so they have a right to literally do whatever they want to the people because it's to the people's benefit. That's a classic example of paternalism. Now, clearly we find out from our experience that there is a huge danger in that because many countries in the world did and still do similar things. I grew up in the Soviet Union, I know it firsthand. First, Soviet Union was very much an example of paternalism. They were basically deciding what people should read, how people should live, and it's all for your own benefit, right? It's just so that you would not be subject to those horrible market forces, evil capitalism, and so on. And in addition, they were restricting movement. You could not leave the country. Again, for your own benefit. Because, I mean, you go to these horrible Western countries, and they'll brainwash you, and they will do bad things to you. So, but obviously, especially when you grow up, I really felt oppressed by this. I felt like this is so unfair and so stupid. Let me go. Let me see for myself. Let me If there are evil influence, let me be a subject to this evil influence. I am an individual smart enough to be able to counter it. But no, they did not believe that was a good idea. So then Soviet Union collapsed partly because of that. So another example, cosmetic surgery, beneficence and cosmetic surgery. So remember, beneficence tells us that we should do, as medical professionals, whatever is to the benefit of the patient. But what about cosmetic surgery? Is it to the benefit of the patient, like The Last of Us? Because that's another good example of paternalism. Did you guys watch it? But you're familiar with the concept, like the first season ends, I don't know, does anybody know how the first season ends? So he brings this girl who is immune to the zombie whatever to a clinic. And that's the whole first season. He brings her to the clinic. Sorry for those of you who didn't see it, the spoiler, I will have to tell you how it ends. It ends that he brings her to the clinic, and the doctors take her, and she's supposed to help humanity because she has this immunity to the, whatever it was.
Is it like a virus? Or
Something.
This is a
Fungal, yeah, fungus of some sort. But he finds out that in order to use it, they will have to kill her. So there's no other way. They will kill her, and then that will help cure humanity. And even though he brought her there, and of course he wants the humanity to be cured, he of course has a problem with her being killed. So as a result, he just kills a bunch of them, including the doctor, and takes her out and saves her. Was he right to do it? You see the ethical dilemma here. This is a great example of ethical dilemma, something you could use for your paper, for example. Right? On one hand, it's the benefits of the humanity. We will save so many millions of people. On the other hand, well, that specific girl, who he actually already had a very close attachment to and loved her, in a non-sexual way, I guess, will die. And they know she will die. It's not even like maybe. No, they're going to kill her. Do they have a right to kill her? Like the beneficence actually tells us that obviously that should not be done, because in this case she is also a patient. Yes, she has immunity. Yes, that can save the humankind, but you can't kill her. If it was not a hypothetical situation. If you're utilitarian, yeah, definitely. I mean, like millions of people would have life, because they were actually dying from those zombies all over the place, and the humanity would be much happier for sure. But one person dies. We have to kill her. So from utilitarian, yeah, but like from your personal perspective, what would you say? Yeah, that is this type of a problem. And in this case, like obviously the benefit is huge. The entire humankind is saved. And the loss is, well, just one person, not like 3 people or something. But at the same time, it does seem a little cynical, because you actually do have to kill her. She is a healthy girl. She even has immunity, right? So she is in no danger whatsoever. You're literally killing her. And she is super young, too. It's not like she's 90 years old, so it's like, okay, well, whatever. But she has her whole life ahead of her, and you are going to kill her? Well, obviously, this actor, or the guy who he was playing, made the decision that that should not be done. And since the people in the hospital were completely committed to killing her, he had to kill them. Now, a bunch of people died as a result of this, but not the girl. The girl was saved. Did he have a right to do it? Yeah, that's a tough one, huh?
Overstepped, like killing other people. It's one thing if you snuck away.
Well, it's basically, he was, of course, I don't remember all the details of this last episode, but he was kind of forced, because they had guns and they would have killed him.
Their point is, it really just goes
Yeah, it's like wrong or wrong. Which wrong is wronger? Obviously, you don't want to ever face decisions like this, but we might. It's again the situation which could happen even in a work environment. Like remember the Chernobyl disaster, they got like similar decisions to make about their lives and about lives of others. Like if you work there in some sort of capacity of a manager or something, do you order people then to go and do something even though it is going to endanger their life? But that saves other lives because that could be more dangerous for the population in general. So it can happen. Hopefully it's not going to happen, but it could. And it is, again, difficult question. Theory, if you apply theory here, yeah, utilitarianism will tell you one thing. It will tell you, of course, you can sacrifice one person for the others, but you can see immediately how utilitarian cannot be a solution for every problem because here there's many other issues. And for most people, just like for this guy, actually it would also be about how am I attached to this person, right? It's one thing if it's somebody you like barely know. It's another thing if it's your loved one. Then, of course, you will have a very different reaction. And as human beings, we cannot be completely impartial in this sense. We will always look at it from the point of view like, how much does it mean to me? And that would affect your decisions. Should it affect your decisions? Well, the arguments to be made that it should and that it shouldn't, that you should be completely impartial, but at the same time, if you're completely impartial, does it even make you human? Are you some sort of a robot? Right? Yeah, so back to cosmetic surgery. Like I said, there are two types of therapy, therapeutic and enhancements. Therapeutic intervention returns people to normal function. Somebody had a car accident, right? They disformed, so they do something to bring them back to looking closer to how they used to look. But enhancement, that is a trickier one, because in this case, you have a healthy human being who just wants to like change the shape of their nose or something. Is it ethical? They are autonomous individuals, they decided to do it, but it always carries some problems. The most extreme case, actually, which I want to discuss a little bit, leg extensions. You know, they do leg extensions. That can be done. Should doctors even do it? Because what happens is you gain a couple of inches of height, you are a little bit taller. Now, from the medical point of view, that really doesn't give you very much, right? Psychologically, you may feel better about yourself, but it's not like taller people live longer or something. Yeah.
I don't know. Like to do it too. I'm pretty sure they like break your legs.
Yeah,
and,
they do.
Like just.
And they put some titanium
or something like that.
stuff in there, and that's very painful. It's dangerous. It's just creepy to even think about it. Like seriously. So for a medical professional, is it even ethical to perform this operation, regardless of what the patient wants? The patient maybe wants it, but should you? Like, should you just not say, you know what, I don't think you need it? And like, if it's life-saving, it's one thing, but just to look a little bit taller, I mean, come on. But unfortunately, since it is money and people are willing to pay for it, like if it was free, then I'm sure no medical professional would even bother. But for money, it's your money. And that is clearly an issue, right? Does cosmetic surgery meet the definition of beneficence? Is it really benefiting people? Well, from their perspective, I guess it does. Although sometimes they then get disappointed, come back, and even sue them, right? Because there are many cases when somebody has their nose changed or something, and even though it's not completely horrible, but it's not as they expected it to be, or whatever. And so, yeah. That cosmetic surgery in general is like this whole field which is very ethically questionable. And yeah, in some cases when it is restoring the way people were before some sort of an accident or something, that's one thing. But taking healthy adults and doing things to them which frequently are dangerous for money, just because they are paying for it, that does seem to be very questionable. Okay, no maleficence. Remember, that means do no harm. The saying which we can apply here is better safe than sorry. In many cases, negligence can be very, very costly and bad for people. Non-maleficence doesn't tell us what to do, it tells us what not to do. So some examples from non-medical field would be leaving gun unprotected, right? You're not really doing anything to harm anybody. You're not shooting people. But if you left it unprotected and somebody took it and did harm, closer to medical field, the question of the abortion. A fetus, can fetus be harmed? Is there harm being done to this child or a fetus, doesn't matter what you call it, right? That can also be questionable because on one hand, this whole area is very ethically difficult because on one hand it is a female body, on the other hand, at some point at least there's clearly another body present. Does the woman have the right to do anything she wants to? Or are there boundaries? What are the boundaries? And so on. I don't want to go too deeply into it. Obviously, it's very politically motivated too. It's not a good area to talk about. But it's life. People face these decisions. And obviously, that is important to many people. Opioid epidemic. There's another great series which comes to mind. I watched it about it. And that is a huge problem in this country. They prescribing, I must tell you, they prescribing all sorts of crazy medicines for no good reason. Like when I had my wisdom teeth removed, and I did have them removed eventually, they gave me pills which are like Advil, and they didn't even ask me. They gave me another one which is like this strictly prescription. They have limits on them, and the doctor said, well, if it's very painful, take this one. I was like, am I going to need it at all? I didn't need it. I even didn't take the other one they gave me. I just took normal Advil, and for me it was enough. I don't know, maybe some people have very bad sensitivity, but I immediately thought to myself, that stuff is addictive. Why do they even give it like this? It seems a little bit too easy. Don't you guys think? Like if I came back to him and said, I have a pain so bad I can handle it, maybe then he could have, but just give it, just in case, there, prescription for some very strong opioid-based and pain medicine, when I never even said I have pain in the first place. It seems to me a little careless. And yeah, it happens. We have, as the book says, around 80,000 opioid-related deaths in 2021, and a lot of it comes back to them prescribing it. This show I watched on Hulu, Dopesick, was talking about the Purdue medicine, the actual case when this OxyContin medicine, which they were very aggressively advertising. The main character here, this doctor, a nice guy. And he didn't even know, like he went to one of those conferences, just like medical professionals always go, and they gave a presentation. They said, it's not addictive. It's a new type of opioid, quick release. Patients never get addicted to it. You can prescribe it very easily. And he thought, okay, they're professionals telling me it's fine. They even did some research, which apparently the company paid for, and it had some results which were very convenient for them. So he started prescribing it. Bunch of people got addicted. Then in the series, he himself actually got it prescribed when he had some knee problem or something, and he himself got addicted. And he realized how bad it is because apparently it like rewires our brain. It's a kind of addiction you cannot get rid of. And of course what happens then is the doctor gave it to you for a couple of weeks. Then it ran out. Doctor doesn't give it to you anymore. Doctor says it's enough for you. But you require it, so where do you go? You go to the black market, you buy all sorts of crazy stuff which can easily kill you. And then your life is ruined. Because you live for that stuff, you lose your job, you lose everything. You start, like, I don't know, robbery, committing robberies and so on. Well, that's a huge issue, and eventually that company did get sued. Was it here? Well, anyway, the company got sued. They did pay restitution. Several states demanded restitution and so on. But the people already their lives are ruined. And they did it in a somewhat malicious way because it was huge profit, so they were advertising it, and since it is addictive, people were getting hooked on it. And they are giving doctors bonuses if they prescribe. That's another unethical part, right? Pharmaceutical companies do actually pay medical professionals kickbacks for prescribing their specific types of medicine. There's even salespeople who go to doctors' offices and tell them, hey, there's brochures. And for doctors, it's a huge source of income too, because they do get some percentages or whatever, bonuses from them when they prescribe a lot of this stuff. But how is it ethical? You can't, convince a medical professional to prescribe something just because it gives them profit. It really like puts it on a very dangerous track. Many of them may indeed still be ethically sound and not do that, but for some at least that may be a huge temptation. Like, hey, I need to pay off mortgage on my house. What's to prescribe few extra pills to a few extra patients? No big deal. They're big boys, they can handle it. And then a doctor tells you this is a prescription you need, so you will take it, but that can be bad for you, that can be dangerous, and so on. Now the question of justice. One concept of justice that we ought to treat similar cases in similar ways. We actually will talk more about it next on Wednesday when we talk about equality. But it also is related to treatment, right? To medical care, and especially in this country. The rich people and the poor people. Rich, obviously getting better treatment. In this country for sure, because it costs a lot of money, but if you have money, you can get the best treatment. And the less money you have, the harder it is to get any treatment. Is it fair? Because justice, remember, is a question of fairness. Is it really fair? We can think about it from the point of view of equity, right? Because it produces very different results. Health equity tells us that there should be equitable distribution of health and health care in society for all people, without regard to race, gender, disability status, and so on. CDC, in particular, says health equity is achieved when every person has the opportunity to attain his or her full health potential. Now, if you look at the numbers already tell you not everything is very equal, because while overall life expectancy in this country is 77.3 years, but for black Americans it's 71.3, 6 years less, 0.8. For white Americans, 77.6, a little bit more. For Hispanic Americans, 78.8, even more. For black American men, it's 68 years. So clearly, doesn't work equally for everybody, and we all know why, right? Because healthcare costs money, not everybody has money, certain populations have less wealth than others for historical reasons, among other things, and that produces different outcomes. So then the question of rationing. Resources society has are always limited, but how do we distribute healthcare? Based on what principle? Since resources are limited, you can only perform so many heart operations, you can only perform so many appendicitis operations and so on, liver transplants, and the livers themselves, the scarce. So how should it be decided? Because one way obviously is to say, oh, market will take care of it. Well, obviously if you give it to the market, then what happens? The price goes up, only wealthy people can afford it. Especially when it comes to healthcare, because health has this kind of a funny thing. Well, one of the reasons market really doesn't work well here is, well, the simple question, how much is your life worth? How much are you willing to pay to save your life? Is this kind of a market type of question? Is there a number there? Is anybody, what would you say to the question like this, right? What is it, $1 million? You give me $1 million, I'm willing to die? No, I don't want to die at all. There's no amount of money. You can give me bazillion dollars, I don't want to die. At the same time, to save my life, how much am I willing to pay to save my life? Well, the honest answer would be everything I have, right? So that creates an opportunity for overcharging people. Because if this is very inelastic type of demand, you really cannot stop treating disease just because you don't want to pay for it. If you have a disease and you have money, you will pay, no matter how expensive it is. But because of that, just today I read in Wall Street Journal, we have one of the most expensive healthcares in the world, and they give all the numbers there about why the medicine costs the most, like several times more than in the other most expensive country in the world, which is Netherlands. Doctor charges us more for visits. Doctors making several times more than the second country in the world with the most expensive healthcare. Nurses charge more. There's a whole bunch of bureaucrats who also make money on it. This whole mountain of people and charges, of course, comes out of the people's pockets. But is there a way around it? So one way would be obviously to look at it from utilitarian point of view and to see how do you maximize it. But what's the fair way then to distribute care? It's actually a problem not just in this country, but everywhere, because in Great Britain, I told you guys, they have free medical care, but when it's free, you have also the problem of rationing. And especially since then the government pays for it, right? They collect taxes and then it's a part of the budget. But they constantly also run into deficit. There's not enough money, so what do they do then? They have fewer nurses, they pay less money to the doctors start leaving, they go into different countries, there are fewer doctors. It's been happening for a long time. And how do you decide who gets care? Let's say you only have one liver, but 10 patients need it. Who gets the liver? Is it the youngest person, first in line, the one who requested it first? Or should you just run a lottery? Frequently people think lottery is fair. Is lottery fair? If you don't know who to give the benefit to and you just flip a coin or something or do the lottery, is this fair? Well, on one hand it seems fair because there's no human will attached to the outcome. But at the same time, could it be then that the outcome is far from ideal? Like let's say you have 10 people, 9 of them are 80-year-old and about to die, 1 of them is 20-year-old. You flip a coin and the 80-year-old gets it. It seems like that in that case it's not very fair, but this is the chances if you do it this way. So another way looking at social worth, but again that's such a loaded concept. So if somebody is a more important person, a better educated person or something, should they then get it? If somebody is more valuable to the society, from utilitarian point of view, you can say, yeah, 2 people are sick, one of them is a homeless bum who has no money, no job, no good for anything. The other one, a businessman, CEO of the company, millions of people work in his company, he's so important. Both of them need the liver, both of them will die if you don't give them the liver, so who do you give it to? It seems like on one hand, from utilitarian point of view, you should give it to this businessman. On the other hand, there are so many issues with that because it does seem unjust. Right? And it's not always that obvious too. In some cases, the difference may not be as huge. So then who makes this call? How do they make it? It's a difficult, very difficult question. Some suggest so-called fair innings. What is fair innings? Life year maximization. There are a certain number of years that are expected in order to have a fair share of life's goods and experiences, right? So for example, you can say everybody should have at least 60 years of good life. And once you are done with it, you have less of a claim for medical and other benefits because like you had your fair share. And if somebody is younger than that, then they deserve it more than you. COVID-19 actually literally had these questions for medical professionals because they had shortage of ventilators, right? And who do you put on a ventilator? You have 10 sick people, all of them are about to die. Again, 9 of them may be in their 70s, 1 of them is very young, like in 20s or 30s or even 50s. Who do you give the ventilator to if you only have 1? And frequently that was the case. By the way, it reminds me that I read at the time that there were some rich people who just bought the ventilators for themselves and they had it at home just in case. Like if I get sick, I have it here. Like is that ethical? Well, they had the money. If you have the money, even though it's not supposed to happen, but we all know if you have a lot of money, it will happen. Even if you restrict it as much as you want, like you pass the law that in this country, any medical professional who sells the ventilator goes to jail. Okay, they'll buy it in North Korea or something. They always find a way to get around the system, and that is a problem. But how do you resolve it? So some scholars like John Harris suggest that the whole approach is ageist. How do you decide that? How can you say like, okay, you are old enough, you have had your fair innings, now it's time for you to go? Well, there are people in their 70s who may be more full of life and energy than the 20-year-old, right? You can't generalize like this. For different people, life cycle is different too. So that seems like an overly simplified approach. Human rights. So is healthcare a human right? We almost run out of time, so I want to come back to this next time. But this is a huge question for us. Remember, Bernie Sanders and many other people say that at least in terms of healthcare, everybody should have a right for healthcare. There's definitely something very unfair to see people refuse care because they don't have money. And it happens all the time. Even though legally they obligated to provide care, but for one thing, not every physician, right? You have to go to emergency room, which already is, there are long lines there, problematic. On the other hand, they still, if you don't have money, they'll do the minimum, but they're not going to really treat you. It's like, okay, we have to provide some care here, but since you don't have any money, we'll do the minimum of the minimum, and then good luck to you. So that's the big issue with that. Okay, I guess we are out of time for today. But like I said, since we're talking about social justice next time, that's closely related, we can come back and finish up that subject and go into social justice. See you guys on Wednesday.